Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We've had a lot of questions about, I always say to you, take good care of yourself, and then you say, well, what should I do to take good care of myself? Well, one of the ways you can take good care of yourself is through screenings, and obviously your, what I would call your required doctor visits, once or twice a year. But we're going to talk about that. So let me introduce two people in front of me that we're going to talk about the whole issue of wellness and screenings. To my immediate eyesight here is Dr. Vlad Gorbati, who is a board-certified urologist and is with Broward Urology Center. Welcome.
Thank you so much, Dr.
Where is Broward Urology Center?
We're located in downtown Fort Lauderdale. Our practice has been there for about over 35 years, and we're happy to serve the community here, and thank you for having us.
Thank you for
on
being
this
here.
show.
Thank you. And this nice, good-looking gentleman over here. We were talking about motorcycling and stuff like that before the show. Doesn't look like a biker, but he is. Edward Cornwell, who is the men's health coordinator for the Man Van, which is a Broward Health feature, and you're stationed at Imperial Point.
So that's correct.
Tell us about the Man Van.
Yes, I am very pleased to be the coordinator of a very special program at Broward Health and Imperial Point called the Man Van. The Man Van, in a nutshell, is a very modern 38-foot bus equipped with all the medical devices needed to provide health screening to both men and women on the spot in less than 30 minutes. Using your current insurance, and even those that are uninsured, they can still get the screening for a low flat fee of $75. And we come to your place of business, or you might bump into us at your next community event, a concert or a marathon. We might be there. You might as well take advantage. You don't have to miss work. Come aboard, get health screened. In about a week, you have your results.
There's a number of blood tests that are done from the, I would assume you have a phlebotomist on the
Yes, we do. We come out with a team of a driver, because it's a very big bus, a registration person for the insurance and the identification, a nurse, which will take your BMI, and then you move on to the last part of the bus where the phlebotomist is located, and she will draw your blood, which we bring back to our laboratory at the hospital. And we screen men for 10 different things: cholesterol, triglycerides, testosterone, thyroid, prostate as well, and women for 9 different things. So the whole 9 yards in less than 30 minutes.
Mm-hmm. Do you do any vascular screening on that bus as well?
No. Complete metabolic profile,
right?
Lipid profile.
I see. So it's basically what you're doing is you're taking the blood draw and providing those results back to the physician community, correct?
We bring more than just the convenience of having the bus parked outside and you can just step outside and get your health screening and be back at work. Yes, that saves you a lot of time and money, but it also offers the opportunity of perhaps getting the annual health screening, which in many cases people just procrastinate or not, or they don't have free time, sick time to be able to leave work. They can't leave work and get that very important health screening every year. So we provide not only the convenience, but the opportunity of checking on your health. Otherwise, you might go years without checking on it and be surprised one day when you finally get that health screening.
Okay, that's great. Dr. Gorbati, out of full transparency, as I was sitting here listening to Mr. Cornwell, I just realized that your practice probably was the home of Dr. Fowler, right?
Yes, sir. Yes, sir.
Well, he was, and again, full openness here. He was my urologist for almost 27, 28 years. So welcome to a great practice.
Thank you very much. I'm very happy to represent our practice. Like I said, we've been in a community for over 35 years. We've I come from a great line of urologists, including Dr. Fowler. We still have in practice Dr. Yogel and my partner who was on the show in the past, Dr. Eric Chenman as well. And we not only serve the patients in near Broward General and downtown Fort Lauderdale, but as well as Imperial Point Hospital, and we have a satellite office there, and we are actively involved in the in helping patients who do detect abnormalities in their screenings done on the man van. So it's a great opportunity.
It's great. You know, there's, talking about screening, there's been I guess almost a national controversy relative to PSA. I'd like you to explain to the viewers what PSA is and what is the, I guess you could say, thought process behind the controversy.
Sure. I think that's a great topic to hit. To all the viewers out there, essentially PSA, it stands for prostate specific antigen. What that is a blood marker only the prostate produces in men. And essentially what we've seen is that the higher that blood test is, the greater the chances there could be prostate cancer. And it's been a marker that was developed back in the 80s, and it's been very helpful in trying to screen for early prostate cancer. And because back in the days before this blood test, we would essentially diagnose people who were only symptomatic, having a lot of urinary complaints, or we would be able to feel an abnormal prostate. And oftentimes this was already an advanced disease, which we would have a very hard time treating. Now, with the advent of PSA, we're able to catch prostate cancer very early in its progression. And there are advantages, but there are also some disadvantages in catching this disease early, because prostate cancer is often a slow-growing disease, slow-growing cancer. So if a slow-growing cancer is caught early, we're really not sure if it's really going to kill a patient, to affect their life. And so there's been a lot of controversy, and some people think that maybe we are over-screening or over-treating some patients. Now, I think this controversy came up back when the U.S. Preventative Task Force, which is essentially a government panel, came out saying, well, based on certain studies, we really shouldn't be using this prostate marker, PSA, at all. And I think, in my opinion, and opinion of many other physicians, to create a blanket kind of recommendation is pretty dangerous. Now, I think certain patients deserve to get early screening. I think if we stop screening for prostate cancer, we're going to see a major rise in advanced disease, as we had seen back before the 1980s. And I think the biggest harm we'll see are the patients with the highest risk of dying with prostate cancer. And those people are patients who have family history of prostate cancer, and specifically the African American community, the young black males who often don't get screened and don't have really good access to screening. I think this man van is a great opportunity for them to kind of wake up and say, hey, this is a great chance for me to get checked. And I think not checking a PSA is going to really affect and cause a rise in the death of that population of men.
Well, I'm glad you got to that issue, because really, like I said, we've had a lot of comments from our viewers relative to the PSA issue, and particularly from I would say our mature viewers, although they're all mature, but I'm talking about age-wise. So there is, but I think there's some conflict relative to other issues involved urologically. We can get back to that in just a second. Let me get to Mr. Cornwell here. Can I call you Ed?
Yes, absolutely.
Good. Ed, tell me about, I know that you do men and women screenings. What do the women who show up, do they ask about mammograms, or what do you do? You refer them?
We refer them to the hospital or one other of our specialists.
Right.
But I'm glad that you mentioned on the PSA, because being there controversy or not, it serves as an early indicator, and not only the PSA, which is part of our comprehensive screening, But any of the other items that we screen as well serve as early indicators, and that reiterates the need of having that screen every year. You doing that every year, it's an early indicator. So if anything is unusual, then you will go to your doctor, and certainly he's going to request other testings, more specific or different kind of testings. But at least you were able to pinpoint that in the very beginning.
Yeah, and I would say the availability, like I said, I think I've seen the van a couple of times outside of a movie theater or outside of a entertainment center or something of that nature. I think it's very important because you could say it's time and interest. I think there's always, I'm not quite sure whether there's a disinterest amongst the public. I just think that it's a time element. Everybody, they get up early in the morning, they have to battle traffic, they go to work, they get tired, come home, and they want to just take it easy. But you go out, and it doesn't take very long to do a blood draw. That's for sure.
Home, work, home. Sometimes you don't have sick time to be able to miss work and go to the doctor, miss work and go to the laboratory, miss work again probably and go back to the doctor just to read the results, to interpret the results. So it's not only convenient, saving time and money, but it's the opportunity it's practical. It's right there, the opportunity of checking on your health and see if everything is in order. You do that every year, you end up with no surprises.
Dr. Gorbati, not to take away from the value of preventative screening, but having you here, knowing of your background, because we spoke before the broadcast, knowing that you are very adept in the use of robotics.
That's right.
One of the things that our viewers always talk about to us, is that the two biggest items of reference is they always want to know about cancer, cardiovascular disease, and minimally invasive surgical techniques. Because when they think of surgery, they think of both of those items, cancer and cardiovascular disease, and they say, oh, well, I have my chest open, or I'm going to lose something, or I'm going to have this massive surgery, and they think of blood, cutting, and pain. And then when they're very interested in minimally invasive techniques. Now I know that you are specifically trained and expertly trained in the field of urologic use of minimally invasive techniques, otherwise known as robotics. So let's talk about it.
Well, I'm glad you bring that up. But yes, this is my forte, in that I've taken the extra time, over 3 years of extra fellowship, in just learning the newest techniques and addressing whether it's cancer or even kidney stones. I think this technology is amazing in that it allows for patients to recover much faster. The surgery itself is still complex. It's still a big operation, but it's all on the inside, as I tell patients. And the advantages to a lot of these minimally invasive techniques is that the cuts on the belly are smaller. Therefore, we can use less narcotics and less painkillers, and patients can bounce back from surgery a lot faster than what we've seen in the past. Now, all of these techniques are trying to essentially mimic the big open operation, but we can do all of this through either a few little cuts in the belly, and nowadays even through a single incision, through just the belly button. And so I think this is pretty much the future, and nowadays even the standard of care. For instance, the prostate cancer operations are over 85% of them are now done with the use of the Da Vinci robot, and I'm happy to provide this kind of technology and care to our patients locally, just like any other major cancer center.
Well, and again, knowing the facilities that you work in, if I'm not mistaken, you work at Broward General and the other facilities, but also at Holy Cross, if I'm not mistaken. Is that correct?
That's right, and right. Imperial Point
and
Hospital.
Well, Imperial Point, like I said, the other Broward Health venues. But I really think the people are very, very interested in that because, again, they want to have a quality of life. So here we have screening, which indicates to them, hey, you better check this, or they send the results to the doctor. The doctor says, you better check this and I'll keep you well, or I'll make you better.
The starting point.
Right. And then we have people like yourself who are the practitioners who are involved in not only the general urologic care for both men and women.
That's right.
But now, the reason I wanted to bring up the minimally invasive surgical techniques, otherwise known as robotics, and as you were saying, is because they're very interested in that. The viewers are very, very interested in that. But I think equally so, Ed, they're equally interested in, for example, I mentioned, they say cancer, they say about cardiovascular disease. They always want to know, what is the lipid panel? What's my cholesterol? What does my lipid panel say about the condition of my heart, or the indicators that I should see a cardiologist?
Yes, one of the big questions is, where do I start? Should I go to the doctor? What kind of doctor? What kind of blood test should I get to screen for as many things as possible? So the big question is, where do we start? You start by inviting us to come over to your location, to your place of work, or to your next community event. There's no cost to bring out the bus to you. And if you want to make sure that we do accept your insurance before we come out and screen your employees, give us a call, 954-279-7946. We'll be glad to check if your insurance is covered. We'll schedule the hours with you so the employees know in advance. And we bring out the bus. We'll be parked outside, but the employees know in advance that we're there. Or, like I said, you might bump into us at a community event. Take advantage of that. I speak out to the employers. You want to make sure that your employees are healthy. You want to make sure that your employees are not absent, either because they're sick or because they're out visiting the doctor or the laboratory. I speak out to the employees. Tell your human resource department to give us a call. We'll come out and check your health screening. Don't use your sick days for the doctor or the laboratory unless you have to. Use the opportunity of getting screened right there.
Okay, well, that's very, very important. Dr. Gobari, I'm getting back to you again. I don't mean to stay with these surgical techniques, but also I want to talk about something which, since I have you here, and knowing the practice that you are associated with, one of the things that we constantly hear from our viewers is BPH. Tell the people what BPH is and talk about it a bit.
Well, BPH stands for benign prostatic hyperplasia. Essentially what that means is a benign enlarged prostate. And essentially what that means is that the prostate gland is sitting just below the bladder. And as guys try to pee, the urinary flow is going through the prostate. And if the prostate gets bigger, it blocks the flow and it makes urination much more difficult. Now, I think the biggest concern when men have some urinary issues is the concern for prostate cancer also. And that's our job as physicians to figure out, are we dealing with prostate cancer symptoms or really the benign prostate enlargement? For most part, it is the benign prostate enlargement. And we have, over the past 30 years, we have come up with both medical and surgical treatments that are less invasive than most men used to face. And so I think part of the issue that you and Ed have brought up regarding screening is that men are just anxious about getting checked by any physician. And I think that the screening van is an opportunity to kind of bypass those anxieties and commit to taking care of yourself as a man. And I think, whether you're having some mild urinary symptoms, I think or if men are having some sexual side effect problems, that's as you brought up the issue with heart disease. We have great studies showing that sexual function is a great correlation towards heart disease, and that if a man is having some erectile function problems, that's a blood flow problem, and typically that can correlate with a future heart attack. And so I think you had Dr. Zachariah as a guest in the past, and you know, he's a cardiologist at Imperial Point, and essentially I, as a urologist, if I screen the patients for sexual problems, I send them over to the cardiologist immediately, because, you know, we need to help men early, and treating early problems so that we could prevent the major disasters in the future as they get older. And I think the Man Van gives us that opportunity to target those patients who are a bit more anxious about their symptoms and anxious to approach the physicians about their problems.
One magic word that he used was anxiety, especially when it comes to prostate. People do come on a bus and they want to know what kind of examination is for the prostate. So, well, I understand your question, but if you get screened every year, well, we examine your prostate with your blood. If you don't get it every year, then you're going to have to examine your prostate in other ways.
Let me just not leave the women of our viewing community out of this, because there are a lot of problems that are inherent within the female community urologically, and if you just touch on them, because we're down to the last 3 minutes of the show.
Oh, absolutely. I mean, the patients that we see who are women in our practice, many patients, we address kidney problems. So kidney stones is a very, very common problem, not only in men but also in women. And nowadays also children, because many kids are becoming more and more obese. That increases people's risk for kidney stones. We also address a lot of urinary complaints in women, including urinary incontinence. And those complaints can be treated both medically and surgically. So there are medications to help some women. And I think it's a lot of the cancers that we address, including bladder and kidney cancer, also occur in women, and I think that's very important to point that out.
Well, you know, it's interesting, because I was observing the other day with my wife the number of ads that are on television relative to women's incontinence.
No, it's a very, very major problem that has been quiet. You see, a lot of the urological issues are very hush-hush, very anxiety-driven, but I think more and more the marketplace is driving those issues out in the forefront. For instance, until Viagra, men really would rarely discuss sexual health with their physicians, and until a lot of these women's issues were up front, a lot of women were scared of getting screened for breast cancer and other diseases.
Right. Well, we're down to the last 2 minutes of this show, and I want to get back to you, Ed Cornwell, because the main focus of the show is wellness and prevention, and that leads to screening. So let's hear one more time about the Man Van. Otherwise, I'll call it the Well Van, but you call it the Man Van. Go right ahead.
We make it easy for you to get that health screening. 954-279-7946, employer, employees, or community events. We'll come out and provide those health screenings for you. Call to ask the questions like insurance. Call to ask more information about exactly what kind of screenings we provide. We make it easy, we make it convenient, and we provide the convenience and the opportunity to get health screened on the spot in less than 30 minutes. It's absolutely painless.
And I would assume, again, this is, I don't know, I'm asking you really, but my assumption is that the Man Van reaches communities where there might be less transportation. We have a big public transportation problem, I believe, with all due respect to our triad here in Broward County, because we're so large, and we have population centers that, are always using roadways, so therefore public transportation doesn't pay for itself. But there are a lot of communities that have a lack of transportation.
And lack of insurance as well. So we go to two different places. We go to businesses where everybody is insured unless you're part-time. But we also like to go to the low-income areas of cities to provide that low flat fee of $75. Otherwise, if you were to go to a lab and get that comprehensive screening, first of all, you need to go to the doctor and get a prescription for that. and it's not going to cost you $75. So $75 is pretty much to cover the expenses.
And I also understand, and we spoke about it earlier before the show, is that a lot of companies, a lot of businesses are crediting people with some bonus or something.
The Broward Wellness Program.
Right, right, which offsets the costs, correct? Right.
And it turns into benefits for the employee depending on the company that you work for. It can be a dollar value in your paycheck. It could be extra sick time hours, personal hours. There is some kind of incentive of getting the employees screened to make sure that they're healthy to work and healthy in their personal lives as well.
Okay, well, we're down to the last 30 seconds of the show, so we want to say thank you.
Thank
Ed
you for having
Cornwell.
us.
Thank you very, very much. You're the men's health coordinator at Broward Health, and you're at Imperial Point Hospital. And Dr. Vlad Gorbati, welcome. I haven't had the opportunity to see you. I've seen the chief of staff and your partner, and maybe I'll say hi to you at the practice at Broward Urology Center, and we really welcome you. I know you've been here for a number of years, 3, 4 years, whatever.
3 years, yeah.
But we welcome you to our community. We welcome your capabilities, your advocacy. And besides which, you have your wife, who's a doctor who graduated from Nova Southeastern University's College of Osteopathic Medicine. So we're very proud. So thank you very much for being here. Thank you both for being here. Remember, folks, the purpose of this show is to remind you, take good care of yourself. And one of the ways to take good care of yourself is listen to what was said here. And if you have any comments or questions, there's an email address and a phone number right here. Feel free to give us a call. Remember, this show is your show, and if you have any subject matter you'd like us to discuss, let us know. This show is called Dateline Health. We come to you from Nova Southeastern University. And until next time, this is Fred Lippman saying, see you.